Hi, everyone, and welcome to this exciting Aeroflow Health webinar called The Silent Struggle, How Health Plans Can Champion Mental Wellbeing. May is Mental Health Month, so we're honored to present this what I think will be a very interesting discussion of how health plans can collaborate to provide better mental health support for their members, with a specific focus on maternal health as a case where there are a lot of challenges with equitable access to care, different mortality rates, and how this approach, combining together the strength of a health plan with a durable medical equipment organization and behavioral health support, especially for situational stressors, can make a difference for pregnant people and new moms. So really looking forward to this discussion. Let me get a few housekeeping items out of the way before we begin our discussion. First, just a reminder, the goal of the Aeroflow Advantage series is really Be in the Flow series is really to take on the most interesting topics that are relevant to health plans as they navigate an increasingly complex healthcare environment, and to share with you what we've learned and what we're learning about how to improve quality of care and accomplish the quintuple aim goals for health plans and their members. Last webinar was a fantastic discussion of a really interesting topic. I encourage you to go to look on our website where we have recordings of all of our previous topics, which have included things like food as medicine programs, use of continuous glucose monitoring, diabetes control, and today we'll be talking about behavioral health. Our last one was really about the importance of incontinence management and what an opportunity it is for health plans to improve that by supporting their members. If you have questions that come up, if you're watching this live, please put them in the chat. We will be answering questions. I'll be watching that throughout the course of the webinar and try and work those questions in, as this will be a discussion back and forth between the panelists and myself. And at the end, we'll have some time for those questions too. We'll remind you as well, so please don't hesitate to use the chat. Let me have our panelists introduce themselves. We begin with Ryan Bullock, who is Chief Strategy Officer for Aeroflow Health.
Hey, thanks, Mike. As you mentioned, Ryan Bullock, Chief Strategy Officer with Aeroflow Health. I've been fortunate to have been with the company for 15 years, actually, this year.
Great, glad to have you with us. Ann Wanland is co-founder and CEO of Canopy. Ann, let's tell us a little bit about you.
Thanks, Mike. Yeah, I'm so happy to be here. Very excited for today's conversation. Ann Wanland, co-founder and CEO of Canopy, which is focused on prevention and early intervention in maternal mental health. We have a comprehensive digital platform and partner with Aeroflow to bring expecting and new moms mental health support at the population level. My background's in global health and maternal health, and I can't wait to share what we've done together and what we've learned working with health plans.
Thanks, Ann, and welcome. And Jen Jordan is joining us as well. She is the Vice President of the Mom and Baby Division for Aeroflow Health. Jen, welcome. Tell us a little about you.
Hi, thank you so much, Mike. Jen Jordan, Vice President of the Mom and Baby Division here at Aeroflow Health. So the Aeroflow breast pumps brand is my baby here at Aeroflow. I've worked at the company for over 13 years and have been fortunate to be able to support new and expectant moms on their pregnancy, breastfeeding, and postpartum journey. We really focus on being that trusted resource for mom and an encouragement during what's a really exciting and challenging time of her life.
Great, glad to have you with us today. And I'm Mike Cantor, Chief Medical Advisor for Aeroflow Health. I've worked with the company for a couple of years now, and my background is in geriatrics and law, and I've had a lot of experience working as Chief Medical Officer for health plans and provider organizations, and for companies like Aeroflow Health that serve patients and members of health plans. So let's get into it. Let's talk about the struggle and how health plans can play a really important role in improving mental health for their members. So one of the things that we've observed at Aeroflow is that the continuum of care for pregnant people is often incomplete. So this top line on the slide here shows a typical patient journey where a pregnant person gets pregnant, they find out they're pregnant, they have prenatal visits, they give birth, they go home, and they have a 6-week postpartum visit, they have new baby, well baby visits with pediatrician, and they go back to work. It's kind of like, good luck to you. We think that there's a different way of supporting this, and that's part of what we're sharing with you in this webinar, is there are lots of resources that can be added that can really add value. Jen, do you want to tell us a bit about what's been missing from the traditional journey and how we can work together, health plans, provider organizations, companies like Canopy and also Aeroflow, to make this a more supported and I think ultimately successful journey?
Yeah, that's such a great question. I think what's really an honor here at Aeroflow is sometimes we're one of mom's first stop when she finds out that she's pregnant. Mom makes the decision to breastfeed very early on in her pregnancy journey. So we're here with her possibly before she even has the confidence to share that she's pregnant with the rest of the world. So we get this tiny little space with mom where she's thinking about feeding, she's thinking about her baby. And she's early on in those, her very first prenatal visits. We walk with her through her pregnancy, supporting her not only with her breast pump. We're providing classes and education and support groups where one, she can connect with other moms, but we're hoping to give her confidence and voice and preparation through our classes and education. Breastfeeding is natural. Breastfeeding is not easy. I am a former breastfeeding mom, and I know Anne is currently a breastfeeding mom. It's a lot of work. It's a lot of dedication, and there's a lot of bumps and struggles. And we spend so much time preparing for that actual birth event, but not really thinking about all the things we need to be able to practice once baby gets home. And then we get this perfect tiny human and we have to leave the hospital with it. And we are confused and overwhelmed and our hormones are going crazy and it's not sleeping and we're wondering if we're feeding it enough. Yet we don't see a provider until we're 6 weeks postpartum. So we really found, especially through our education, which I'm so deeply proud of our IBCLCs and our entire community of educators, they've also created this really great Facebook group. And when you listen to the comments and hear the moms in these groups, they want community, they want support, and they have so many questions and they don't know where to go. So for Aeroflow to be able to be a piece of that, one, we're hoping we're providing a path to success for moms, but I think with health plans, there's an opportunity for us to really partner. And how do we share and triage and assist some of these moms who may be some of the most vulnerable population, and the health plan just doesn't have the information that they're freely sharing with us here at Aeroflow.
Got it. Ryan, you've had some really interesting discussions and collaborations with health plans. What can they do? Like, what is their role in supporting the journey?
As far as health plans go,
Yes.
yeah, I think one of the things that they can help do is maybe quarterbacking some of the resources that are available within the health plan. And I think going back to what Jen had mentioned is what we are able to do is to connect with that mom and build trust in that healthcare journey. I think a lot of new birthing people, this is maybe one of their first major medical experiences and having to deal with healthcare in general. And so we pick that baton up and carry that along with them through this journey. And I think that creates an opportunity for health plans to connect and utilize our platform and the engagement that we have with those members to carry that baton through the resources that health plans have available and make sure that we're making those right connections at the right time when mom needs that help and support.
Great. I'm just curious, both you, Jen and Ryan, how's it different the second time around or the third time around? Do you think that there's still the same need for these resources, or it's pretty much old hat, they got it?
I absolutely believe that every single pregnancy is unique and different. Whether it is your pregnancy or your postpartum journey, um, there is no blueprint and they're not alike. So being able to support that mom, whether it is her very first, she may have more questions and different questions, all the way up to mom who is, having her third or fourth child. She needs that same support because you can reach different hurdles in each unique pregnancy.
Very helpful. And maybe you can share with us, one of the things that's clearly been missing in the past is support for mental health. How important is that for pregnant people and new moms? You hear a lot about it in the news. What's the real what's really happening here, and where does Canopy fit into supporting pregnant people and new moms with their situational stress and distress and overall behavioral health needs?
Yeah. Well, first of all, I just agree totally with what Jen and Ryan have shared. And I think a really important point that I hope we can all take away from today is that, the experience of motherhood is sort of like these kind of two disconnected pieces. Often it's where are you getting your information, your community, dealing with some of the transition to motherhood really outside of healthcare. And then there's like the super clinical stuff you do with your OB, and you see your OB regularly throughout pregnancy, and then once hopefully postpartum at 6 weeks, and maybe not again until the next pregnancy. But the thing that is so critical about motherhood is that it's these pieces are so interrelated. What is going on outside of the doctor's office is absolutely affecting, that experience inside the doctor's office and vice versa. They're just so interrelated. And the truth is that maternal health is treated in such siloed ways. And one of my favorite things about Aeroflow is that they've truly, figured out how to fill important support gaps in a trusted, evidence-based way at a population level. And that's certainly what Canopy is working towards as well on the mental health front. And so your question was about mental health. What have we been missing in maternal health? And I mean, mental health conditions are the most common thing to happen to you during pregnancy and childbirth. That's a complication of pregnancy and childbirth. And they are also the most devastating in terms of cost and kind of the long-term impact on both moms and babies. But the first time you may hear about your mental health is postpartum. And there's truly a lot you can do during pregnancy to protect yourself, to understand kind of what's available to you in terms of coping strategies, treatment, care, that can help not just treat but prevent an event. We know that certain people are higher risk. We have a lot of information about that. During pregnancy, you might not be showing up on the depression screener that's typically done, hopefully done by your OB or a provider. You might not be showing up as a pregnant person with low mood, but we see at Canopy, people showing up with a lot of anxiety. And anxiety can be a precursor to developing postpartum depression, or things like being an older mom, having gone through IVF, having multiples, having a history of mental health conditions. These are all things that we know during pregnancy that are increasing risk for having postpartum depression or perinatal anxiety or whatever it is. So what's really missing, less than 20% of all moms are ever screened for a mental health condition, despite all of this, despite us being able to know who's most at risk, despite there being really effective, scalable solutions to addressing a lot of mental health conditions that are triggered during pregnancy or postpartum, and despite the kind of devastating and widespread impacts of it. So, what's missing is screening during pregnancy, but also being proactive about the support we provide people, because it's so hard to access mental health support, whether you have no kids or one kid or two kids. And that's one of the things we're so grateful working with Aeroflow, because we've really been able to do that. Offer expecting moms proactive mental health support, education, and connect them to care.
Great. Although I am shocked that only 20% of pregnant people are screened. That is a terribly low number and
A
completely
terribly
unacceptable.
low number. Yeah. Yeah. 19%
I'm
actually.
I'm glad that this issue is getting the attention it deserves. Um, One of the things that health plans do is they often have maternal care management programs. Aeroflows work closely with those programs. Canopy has as well. Uh, Ryan, what's your sense in terms of what these programs do? And Jen, sort of what do they, when you work with them, how do they staff them? What are the kinds of activities that they're undertaking? And how does it sort of lend itself? You mentioned earlier, Ryan, about quarterbacking. I think that this is potentially how they might do that. If you could say more a bit about how these care management programs work that are focused on maternity.
Yeah, I think more broadly that health plans are wanting to identify and have as many touch points as possible with mom as she's going through that journey, right? And that's where Airflow, as an example, in combination with Canopy, have the opportunity to create those additional touch points and identify moms that are at a fine baseline today, continuing those touch points and monitoring to see if that potentially elevates to maybe a mild, medium risk to a high risk pregnancy, and identifying those moms that, once again, can get put into to programs within the health plan to help them navigate resources to address or at least be able to navigate through whatever that elevated risk is that they're experiencing.
Great, Jen,
Jen
anything you
or
want to add?
Ann, go ahead. I was just going to ask if Jen or Ann had another thought. I know Ann, you work a little closer on the other side.
Yeah. Um, they are uh, uh, often, I think, unfortunately, I think that members often don't know about this wonderful support that's available to them at a lot of health plans, which is, RNs who are, trained in the perinatal period, often just wonderful humans and resources, educational resources, but also connection to additional services, know about additional programs and benefits that are available to expecting members in particular, and sometimes up through a certain period postpartum. Um, and are truly the ones who are, they are trying to help fill that gap that we're talking about that exists between, what happens at your OB and what happens in, the rest of your life in terms of what you understand about your pregnancy, your risks, your questions you have about, whatever it is, vaccines, what do I do if I have this or that? They're really a triage and support arm that is available to expecting and new members. So one of the things that we've done, Aeroflow and Canopy have done together is increase awareness of these programs to expecting moms. When we worked with a health plan, they are interested, for example, in reaching moms in certain geographic areas, certain zip codes, area of deprivation index zones where, they know there are moms who might be have fewer resources, higher barriers to accessing care. So and there might be specific benefits available to certain people who live in another area that need transportation benefits, or, whatever it is. It's a great resource for expecting moms when members know about it. And so Aeroflow and Canopy have been able to collectively educate and then identify higher risk members who could really use some of these this additional support and education. Yeah, that connection has been really powerful. And I won't, bury Lily too much. We'll talk about this in another slide, but they are really, really incredible programs staffed by people who cared a lot about their members, their expecting members.
Great. That's a really good segue, actually, into the next slide, which is really sort of, we've talked about all the different resources could be added from a mental health perspective to lactation consulting, nutrition, and just community, just being able to get answers online from experts who participate, but also from your peers who are going through very similar experiences. So one of the questions, recently there was a program with a health plan that Canopy and Aeroflow both worked on together that was really successful. And we're going to talk about in a minute the details of that program. Before we get there, we'll talk more generally about technology and its role in integrating, engaging, and supporting the members who are going through pregnancy journey. Usually in population health programs, it's pretty straightforward. You have stratification, figure out who you're going to target, you engage them, in other words, talk to them, you provide the interventions, in this case, referrals and resources, and then you measure the results, make improvements, rinse and repeat. In this case, this program focused on issues of disparities in care, access to care, healthcare equity more broadly. So social determinants are really important. But what else was used? Like, how did they do the risk stratification? And you were part of this program, worked very closely. What were the key components of identifying those members who would benefit most?
I feel so excited about this part of the work because it was an acknowledgement of a few things. One is just how interrelated these issues are. If you do have increased social determinants of health barriers, you are more at risk. If you have a high, pregnancy risk, and that was one of the other factors we were looking at pregnancy risk factors, you're also at higher risk for a mental health condition. And if you have a mental health condition or are high risk for a mental health condition, some pregnancy complications are much more likely, including preterm birth. You're 3 times more likely to have a preterm birth if you have an untreated mental health condition during pregnancy. And think about the waterfall of effects on the mom and baby and system overall from that. So we, in addition to kind of to really asking key questions across social risk factors and pregnancy risk factors and mental health risk factors, we were able to segment members, kind of create a hierarchy with the plan in terms of which team should reach out when. So really kind of the behavioral health team, case management, and the high-risk pregnancy team, so that they were, weren't all calling the same members at the same time if they flagged high risk across these different areas, but there was, a clear kind of hierarchy of, okay, we're starting with this, then we're doing this, and then we're doing this. And that's how we can provide that holistic support. But the other thing that I think is really remarkable, we'll talk about the results later, is just that we had very high completion of all of that self-reported information, and it was information that filled some gaps and wasn't otherwise available to the plan. And I think, we'll go into this in a little bit, but I'm excited to talk about the role of trust and providing real value that is so critical for a population that is being absolutely deluged. I mean, I have an 8-month-old. We are, overwhelmed with sort of just like, information. It is truly information overload. It's a little spammy out there. So knowing that you have something high quality and trusted, providing value and asking you for information and giving you answers, I think helps with that stratification.
Agree. And I think one of the big challenges health plans have, health systems have, is engagement. Like, how do you get that person who needs help the most to want to reach out when they have their questions, to actually continue to reach out? And Aeroflow has done a number of different things to successfully engage. Jen, can you share with us sort of how Aeroflow engages with members and what you think are the big lessons that you've learned over the last few years in terms of technology and omni-channel outreach and all of that?
Yeah. I love this question because it's been what we focused on from day one. We always believe that if we've created our business and our experience, leading with mom or the birthing person to be our number one priority, we're always creating an experience that they want to be a part of. I think we've focused on bringing simplicity to care and access. And Ryan and Anne both mentioned earlier, this is probably the first major medical event potentially this person's going through. So navigating insurance is challenging. We're going through open enrollment right now, just, here at Aeroflow, and we work in healthcare and trying to figure out what benefits I have and what plan I want to choose and what best meets my family needs is overwhelming while working in this space. And then when I do have an event or need, care, I'm like, where do I go and what do I have access to? And we really take the approach of making Aeroflow breast pumps and our website and the process of accessing healthcare something so simple that it doesn't overwhelm you. And through, starting with a breast pump and moving into supplies, and now a decade in, being able to layer in lactation appointments and classes and access to Canopy, we've taken a simple, almost e-commerce model and created this entire universe of support and engagement. We're on social. We have an incredible Facebook group and community. We have 50 plus loving clinicians. We have a whole customer service team where if you want to email, you want to chat, you want to call, we're here to communicate you in your preferred method of communication, because Anne just spoke to someone as an 8-month-old. We're busy, we're overwhelmed, we might be working, we maybe can't pick up a phone call, but I can send a chat. So Aeroflow tries to meet this expectant or new mom exactly where she's at. And I think that's been our key, but also doing it in a fun, relatable, accessible way. We want every person who comes to or through our website to feel like we're wrapping our arms around them. No matter what health plan or benefits they have, we want them to feel like they have a place at Aeroflow.
Fantastic. I'm going to move us along, Ashley, to the next slide, which is really, how did this work? So how did you coordinate Aeroflow, Canopy, the health plan, the expectant mom, the new moms, providers? And if you could walk us through sort of how this worked, what you found, what the successes were, lessons learned, that would be great.
Yeah, so this represents, and we're presenting on this with our health plan partner at AHIP in a few weeks. I'm very, very excited. Also have a case study coming out. So this is kind of a sneak peek of some of the results of our first kind of project with them, or we called it a proof of concept, that ended in January with 6 months, where we were, our hypothesis was that we could, through Aeroflow, identify and engage, as Jen said, a large number of expecting moms and introduce them to Canopy, introduce them to mental health support, but also some of the additional benefits they had from the health plan. So using really Aeroflow as the tip of the spear, and then getting them introduced to Canopy, and then Canopy stratified folks by risk, triaged folks to different teams within the health plan, and provided kind of the digital arm of education, mental health support, monitoring throughout kind of the duration of that period. And so kind of identifying care gaps, meeting those care gaps across mental health, case management, so social services and support, and high-risk pregnancy. And having, so, you can see this, the slide has some really compelling data. It was a kind of a runaway success. Everybody, involved with this was extremely happy. Aeroflow has not only a huge reach across the country, but as Jen mentioned, and I've mentioned this before, Aeroflow is kind of the easiest part of my prenatal experience. It's like the one thing that was really easy, getting a breast pump, which is not, getting a free thing is usually not that easy, right? So it's just, really supported experience. And we had, we have different ways of working with Aeroflow. So from cold email outreach to a warm handoff is from one of the lactation classes. The handoff to Canopy from a lactation class is on average 35%. It's been as high as 47%, but it hovers around 35 to 40%. 90% of those moms who are introduced to Canopy through this flow fully completed that risk stratification or screening process, which was really incredible. It's kind of a long questionnaire. And I think, bringing in that value and trust and someone knowing, hey, I'm going to get something that's trusted and going to provide me some value out of this really, really led to that great result. And we were able to identify about 27% of need, basically higher need folks across behavioral health and social determinants of health, and pregnancy risk. So, and they were all supported through the teams of the plan. And truly what is really, it's exciting about technology, and especially if you have good engagement and a good rapport, a trusted rapport with moms, and not just kind of like marketplace, approach, or sort of just opt in, but really kind of thoughtful information and support, is you can create a safety net because people are willing to share information and engage throughout pregnancy and postpartum, not just once and gone, but knowing, hey, this is a place I can go and that will probably lead me to somewhere with additional support, or has led me to somewhere with additional support. And
Yeah. Did you find discrepancies? Like, were there things that you could learn through the Canopy app, for example, that were different than what you could learn if you were a health planning care manager talking to that pregnant person? And how common was that? Did it surprise you? I'm just curious to know, like, what happened in terms of how people interact with technology differently, to your point.
Yeah. I think mental health is one of those things that even if that the feeling of stigma or shame we might hold about struggling with our mental health, it might not feel tangible or present, but it is there, and it affects how we talk about it with others. We'll modify our language. We don't want to put other people out. We know they have an expectation of us. You're pregnant, you're a new mom, that's so wonderful, like that. The initial reaction is congratulations. So if you don't feel like being congratulated, that immediately is a signal to you that I'm not going to be honest, or maybe I'm not going to be totally honest in this conversation. But a technology is not necessarily if you're interacting with something that doesn't feel like there's any judgment, carrying any judgment or expectation of you, you might be more willing to be honest about things. And so we did find sometimes that folks were more honest with what they needed. Truly, we did with Canopy than they were face-to-face when they were, reached out to. And I think that's a really interesting challenge to overcome, and kind of highlights the potential of technology, not as ultimately, the problem solver of everything, but as a way to be a bridge or better surface needs or identify needs, and kind of what is the next step then to meeting those that technology can help with it when someone might not be ready to admit that they need help, or may not have very much trust in the healthcare system or a health plan. And, I think one of the things that we're absolutely proudest of is that Black moms, which was the focus of this proof of concept, it had a health equity focus. Black moms are left out of healthcare, and especially during pregnancy and postpartum, this critical window. So we were really trying to disproportionately engage Black moms, and they were our highest engaged population, and followed by Latina and lower income moms. And I think that's just so exciting because, well, that's why Canopy was created. It's just to reach people who aren't being reached by other methods. And, it was a preventative, we do focus on prevention and early intervention, and the folks who were most engaged weren't necessarily scoring high on the Edinburgh postnatal depression scale, which is what providers use, which is what everybody uses to measure perinatal depression. Questions about cultural competency of that scale. I mean, there are lots of potential issues, but moms were able to engage in their mental health and reported feeling better, even if they wouldn't have gotten a diagnosis or a referral, which I think is just extremely important. We know so many people are flying under the radar, and not getting help because the way in which we ask people how they're doing or ask people about mental health might not be the way in which they either feel comfortable talking about it or resonates.
That's fantastic. And
yeah.
in addition to those outcomes of better engagement, completion of the program, trust, reporting that they felt helped, especially the people who are less likely because of who they are to get the services that they need. What other lessons were learned from this project? Jen, maybe you can start, and then Anne add on to that.
Yeah, I think what was so important for Aeroflow was us, I think, to understand our ability to engage moms in a realm that we've never focused on or really introduced before. Like Anne mentioned, some of these emails it was a cold call to moms. So moving from a breast pump over here to a maternal mental health app seemed like such a huge leap. And to me, it was really important to understand the voice that Aeroflow does hold that maybe I hadn't recognized before, that this breast pump and trust that we gain through, talking to her or assisting her with something that seems maybe so simple and something that may not hold a candle to something like maternal mental health can be a piece of that puzzle. So something seemingly unrelated was the catalyst and ability to introduce moms to something that's giving them the confidence, the tools, the health plans, the information needed to be able to reach out. And I thought it was so important what Anne said about maybe we are more honest with this app because there's not an expectation that we are happy, that we're an excited new mom, that this app is not going to judge me where I love my baby with all my heart, but I am feeling blue today. So for mom to be able to be honest with this app, and then for a health plan to then at that point potentially approach that next conversation with that understanding, they're probably able to assist the mom so much greater than they would have been if it started with congratulations. I'm sure you're so excited, because they already knew mom is more than one things can be true. Mom is excited and loves this baby, but mom might also be struggling. So how can we recognize both of those? So it was so exciting to be able to see our breast pump be able to move into something so much more powerful, that mom needs attention and assistance in this area.
Have you changed the offerings at Aeroflow? Have you updated, for example, lactation consulting classes to incorporate more of a mental health focus? I think integration is one of the biggest challenges we face. I'm just curious to know, have you tried to integrate things more on the Aeroflow
Yeah.
side? And same question for you, Ann, on the Canopy side.
Well, that's such a great question. And one of our most successful classes from very early on, it's been running for a year. We do focus on lactation, but one of our most successful classes is called the brain boob connection. Things that you wouldn't normally correlate, which touches mental health and breastfeeding. So by integrating that within a class, focusing on lactation, focusing on breastfeeding, but also bringing in the mental health aspect, bringing in access to the Canopy app, really walks mom through. And that's what Ann was talking about. 35 to 40% of those moms who go to that class download the app and engage. So Ann is constantly working with and talking with our clinical team so we can make sure that we're integrating and combining when appropriate and being able to introduce just more than lactation, pumping, and breastfeeding to mom, really being thoughtful about some of the other areas that we can support.
Great. And any other comments about integration with Airflow or with the health plan?
It's wonderful because I think back to the conversation Jen and I had when we decided to, do this class. And it just made so much sense. And it's one of my favorite things about working with Aeroflow is just that there's this desire to just do things that make sense for moms, and then kind of the rest will fall into place. And anybody who has breastfed, pumped, tried to navigate a feeding journey understands how unbelievably stressful it is. And that you cannot separate these, the stress of getting through some of these big challenges. Feeding your child is actually really challenging, and the impact it can have on our mental health, and vice versa, the impact that mental health can have on our breastfeeding journey. I mean, these things are just totally interrelated and linked, and I think that's why partly why it's such a successful class. People are not getting mental health support, and I think the brain boob connection really speaks to people because it's like, oh yeah, actually I'm really stressed about doing this. This is actually something that's causing me some anxiety, and I want to feel better about engaging in my breastfeeding journey or pumping, or so yeah, I think
Great.
Jen said it all. Yeah.
Great. As usual, our time has flown by. I have many more questions, but not enough time. Ryan, anything you'd like to add before we go in terms of Aeroflow's engagement tactics, working
Yeah.
with health plans, how other health plans might replicate this? What are your thoughts?
Yeah, I think a lot of what Ann and Jen have mentioned is, establishing trust. Ann mentioned this, and I think back to my wife many years ago when we had our child, and the things that she went through. She was seeking information, but it's cutting down that noise and condensing that to clear, concise, and being able to connect with a community of others that are experiencing the same thing. And I think that's really what leads to the stickiness that we have with engagement and connecting with those moms that come through our experience. And we look forward to continuing to work with health plans to figure out how we can partner and elevate what they're trying to accomplish with what we've been able to accomplish.
Great, thank you. Let me wrap up a few housekeeping items. Thanks to everyone who's joining us today live, and those of you who are watching it online. Glad that you looked at this. Hopefully you found it as interesting as I did and insightful. We will send out a link to the webinar so you can share it with your friends, and also so you can watch it at your convenience. Please subscribe to the Airflow Health newsletter so you can be informed of upcoming webinars. There's a survey at the end of the webinar. We really hope you'll take it, give us feedback so we can continue to improve these webinars. And also Aeroflow Health would love it if you would follow them on our social media pages and look forward to interacting with you there. So thank you so much for joining us, and look forward to talking with you all again soon. And as Jen mentioned, we'll be at America's Health Insurance Plans, or AHIP, at the meeting in Las Vegas next month, and looking forward to having that conversation together with you then. Thanks, everybody. Have a great day.
Thank you.